host, Nurse Choma, your NCLEX prep coach. I am the founder of Choosing Nursing over at choosingnursing.net, where we help you to pass your NCLEX exam. I am a registered nurse. I graduated from San Diego State University with my Bachelor's of Science in Nursing degree in May 2010. So this month is actually my 8-year anniversary of being a nurse and everything. So I practiced medical, surgical, and telemetry nursing for about 4 years, and then about 1 year did insurance nursing, and then now I've been helping people pass their exam for now about 3 years this upcoming June. And we have many, like hundreds of graduates now that have been able to pass successfully to becoming licensed registered nurses, as well as also practical nurses. So you can actually find some of my, just some of them, not all of them, some of our testimonials on the website over at choosingnursing.net. So if this is your first time watching the video, thank you for watching the video. I hope that you will find this information helpful and that it will encourage you, uplift you, give you some instruction, give you some guidance. I come on here every Tuesday now, every Tuesday at 6 p.m. Eastern Standard Time, and give you something to help you better understand nursing, as well as help you to prepare to pass your exam. So if this is your first time, go ahead and follow me right now on the page. You can also follow me over on Instagram over at choosing_nursing. And then you can also follow me over on YouTube. So on YouTube as well, Choosing Nursing. And then finally, you can also follow me over on Pinterest, and Pinterest as well as also Choosing Nursing. So on all of those platforms is where you can find me, and on every one of them, different content, different information, but they're all centered around the NCLEX and then also being successful in nursing. So go ahead and follow me. I'm pleased, I'm glad that you're here. Also as well, I am actually wearing today, we now have our own t-shirts. So this right here, I'm wearing this today. I don't know if you can see the whole thing, but it pretty much says, I am determined to win. I am determined to win, #future nurse. So, you know, a lot of the people that find us, you have been in a position where you've been very discouraged. We get a lot of people who have been frustrated. It's been years since you can't pass your exam, or maybe you're in nursing school and you're just, it's just the process of everything. It can be discouraging sometimes. So I wanted to emulate something that represents how you feel, and then also encourage you at the same time. So this is pretty much our t-shirt. It's called I Am Determined to Win. Hold on, let me do it like this. All right, I am determined to win, #future nurse. Whether you're in nursing school or you're a nursing graduate, if you want to get the t-shirt, 10% of the donations automatically goes to the American Nurses Association. So if you buy the t-shirt, which I believe it's like, I want to say $20, if you get the t-shirt, 10% will automatically go to the American Nurses Association automatically. So to get the t-shirt, go to choosingnursing.net and just go to our products, and you can find the t-shirts that way. We're going to talk about endocrine disorders on the NCLEX exam. All right. One of the reasons why a lot of people are challenged with learning these disorders or understanding the system is because you don't have the overview first, meaning that you want to first get confident with what organs fall under this system, right? So we have the pancreas, right? We have the pituitary glands, we have the thyroid glands. So these are like the organs that fall under the endocrine system. So it's important that you first understand that, because then it's going to play a role with your understanding of, as far as the disease processes. If you get the function, if you understand the normal function, you will get the disease process, not the other way around. All right, so let's go and talk about, I'm going to go over 4 specific disorders with you today. So the first one, hyperthyroidism. So here's the thing you have to understand. Sometimes people are not aware. There are disease processes that have different names, but it's the same disease. So if you're not aware of that on the test, you're going to think it's something else when it's the same thing. So hyperthyroidism can also be, for the NCLEX exam, it can also be referred to as Graves' disease. It can also be referred to as thyrotoxicosis. So you have hyperthyroidism, you have Graves' disease, and also thyrotoxicosis. All of those are different names for hyperthyroidism. So we know that obviously hyper means that it's what? Too much. So this is an example where they have too much thyroid hormone, and that's the reason why they have this disease. It's a constant problem. So here's the thing: you got to be aware when we're looking at this disease is we have to understand, who like the risk factors. We got to understand the signs and symptoms. We got to understand, what is the treatment. All these things are critical so you can see the big picture behind the disease process. So the thing about hyper and hypothyroidism, they're actually both common. It's more common amongst women than men. All right, I'm not sure why that is. And it tends to cause also like menstrual problems for women as well that have hyperthyroidism as far as changes in their menstrual cycle. So here's one tip that's going to help you to memorize this easily. With hyperthyroidism, everything goes up. But with hypothyroidism, everything goes down. Very simple. So now you just apply that to the overall system of the body. So everything goes up. So the heart rate goes up. So I'm thinking about the circulatory system. The heart rate goes up. The blood pressure goes up. With the GI system, their gastric motility goes up. That increases. So as a result, they have more diarrhea because now the GI system is moving more quickly. You have to try and think about don't think about the GI system as just a system, but think of it as something that's a process as well. So that's one thing, is that it's going to increase the GI system. These patients, they tend to feel more hot sometimes. So we want to try and keep the temperature for them a cooler environment. So everything goes up. Blood pressure goes up, heart rate goes up, weight goes up, their temperature, they feel hot. These patients also can have what you call exophthalmos. So that's pretty much the bulging of the eyeballs, right? So their eyeballs are more pronounced than other patients. Weight loss, tachycardia, high blood pressure, diarrhea. Also, their eyeballs are bulging and they tend to feel more hot. So what are we going to do for that reason? Insomnia, absolutely. So just think about, so now you're going to think about the interventions that will treat or match those problems. So I'm going to give them they're going to need eye drops because they have that problem where their eyeballs keep, coming out. So they're going to need eye drops. That's going to be important. Sometimes these patients, they may need to have like an eye patch at night sometimes. Don't get that confused though with Bell's palsy. But at the same time, because the bulging eyes, they may need artificial tears. We want to, like I said earlier, we want to put them in a cool environment. So these patients, oftentimes you're going to see them, they're going to need a fan. I remember when I was working and I had patients where literally they brought a fan from home and the fan was just constantly on. And it was a woman too, because they're just always feeling hot, and it's not necessarily hot flashes, but it's just because of this. It's because of the increased thyroid level that's making them feel much more hot. Yes, that's right, because their eyelids get dry. You do want to also give them fluids. So this obviously depends on how severe it is, like how symptomatic they are. But if they're in the hospital, right? So you want to keep in mind that patients can be admitted, and if they're admitted for hyperthyroidism, that means the problem is exasperated. So meaning that it's more pronounced, like they're having more issues than normal. So we're probably going to give them IV fluids, Usually it's going to be normal saline. All right. We're also going to give them Tylenol, so acetaminophen. That's going to do what? That's going to help to reduce the fever as well, because like I said, they feel hot. So these are all the common things that we're going to do. We're going to give them acetaminophen. We're going to give them Tylenol. We're going to give them eye drops. And then also as well, beta blockers as well for these patients also helps because they tend to have very high blood pressure, like I was saying earlier. One more thing too, anti-thyroid drugs. So there are specific medications for thyroid issues. So you have medications that are anti-thyroid medications, which is called, a very common one, methimazole. Very common medication that we're going to give to these patients as well who have hyperthyroidism. So you do need to know the specific drug name for the test. You want to be familiar with that. So you want to understand all this stuff. That way you don't confuse the interventions with the other one, which is going to be hypothyroidism, right? So one of the things that we're going to do, there's two ways that we can treat it. Aside from giving them the medications and the nursing interventions, remember, that's nursing, right? So aside from that, medically, we can do surgery, meaning that they'll remove the thyroid, right? So they're gonna have a thyroidectomy, where they're gonna remove a portion of the thyroid, or all the thyroid, and that's gonna result in the thyroid levels going down to normal. Right. Also, another thing that they do too that is common as well is they'll give patients something called radioactive iodine. Radioactive iodine. What that is, it's pretty much a way that they will shrink the thyroid gland. So sometimes what we do, remember, we're more depending on the wishes of the patient, because some patients may say, I don't want that. I don't want radioactive anything. But we want to be least invasive first, right? So doing the radioactive to try and reduce the size may be the first option before we go in and take out the thyroid, right? So remember, with the NCLEX exam, it will ask you, because that's what's clinically done, what would we do first, right? So first we're going to try and treat it, symptomatically with the drugs, the fluids, everything else. And then if that doesn't work, then we can do the radioactive iodine. And if that's still not working, then they're going to do a thyroidectomy.